Osteoarthritis is a 55-year-old and was admitted to the hospital with osteoarthritis, having a total left knee replacement. Osteoarthritis occurs when the protective cartilage that cushions the ends of the bones wears down over time. Prior to the surgery, the patient experienced pain, swelling, and loss of function in the affected knee. Significant past medical history includes COPD, hypertension, type 2 diabetes, asthma, and a cognitive deficit disorder. Diabetes affects what is going on with the patient now because diabetes can cause delayed or impaired wound healing. Hypertension is significant because with pain, blood pressure can increase, so it's important to note that the blood pressure could become even higher or their blood pressure associated with pain could be masked by the patient's diagnosis of hypertension. COPD is significant because patients post-op are already at risk for atelectasis and pneumonia. COPD increases the risk for these conditions because it obstructs airflow to the lungs. The patient's respirations were 20 breaths per minute throughout the entire day. A prolonged expiration could be heard upon exhalation. The patient was on 2 liters of oxygen via nasal cannula, which is normal outside of the hospital. Head and neck appeared normal cephalic and the neck was midline. The patient's heart rate was elevated through the day, ranging from 100 to 114 beats per minute. No signs of edema, and capillary refill was less than 2 seconds in the fingertips. Perla in the eyes and no complications associated with the ears. Bowel sounds were present in all 4 quadrants and the patient was passing gas. Urine was dark yellow with a strong odor. Upper extremities were equal and strong bilaterally. Lower extremities were 3 out of 5 for the right and 2 out of 5 for the left. Patient received a brain score of 15. The patient's CAM was negative, but there was signs of cognitive deficit. The patient's temperature was approximately 99.5 degrees Fahrenheit all day. The patient did not eat anything but Jell-O all day due to a nauseous feeling and pain. The patient was prescribed sequentials and adhered to wearing them. The patient's wound was 15 centimeters long and appeared red along the incision line. There was slight swelling around the incision. Farther from the incision, the skin appeared pink. Patient rated their pain 8 out of 10 to 10 out of 10 throughout the entire day. I placed an Aquavax seal on the incision line. The appearance of the incision was normal for 2 days post-op, but the pain seemed to not be controlled despite PRN pain medications. The increase in vitals was expected because the patient's pain was not controlled, even with the max amount of pain medications and adjunctive treatments in order. As a nurse, I should be assessing for complications related to infection, which would be an increase in temperature, increased heart rate, and in blood pressure. I was very concerned about this patient and informed the bedside nurse. The doctors decided to keep this patient longer than expected. It is also important to watch for signs of pneumonia, especially in a patient with COPD. The patient had a 20-gauge IV in the left wrist on saline lock. It was being used to administer IV pain medications, but IV pain medications for this patient were discontinued. The patient was on 2 liters of oxygen via a nasal cannula for their COPD, which they still received at their assisted living facility. The patient had a cognitive deficit disorder, and this affected how they understood the post-op instructions. It was difficult for them to understand that it would be unreasonable to expect no pain 2 days after surgery. The patient had no support from others present in the hospital. The patient also lives alone in an assisted living home with no roommate. Because of these factors, the doctor decided to admit the patient to a rehab unit until the knee was better healed and the patient was able to function better and perform their ADLs. The patient was prescribed Gymfibrazil. This drug is for the treatment of the patient's hyperlipidemia. Side effects include dyspepsia, abdominal pain, and nausea and vomiting. Patient teaching includes taking this medication at the same time each day and maintaining a low cholesterol diet. This medication makes sense because the patient is diagnosed with hyperlipidemia. The patient was prescribed insulin for her diabetes. Important teaching for insulin is to continue as prescribed even when sick. Side effects include hypoglycemia, Metformin is prescribed to improve glucose tolerance. Side effects include nausea, vomiting, diarrhea, and abdominal pain. This drug is appropriate because the patient is diagnosed with diabetes. Bupropion was prescribed for depression. Side effects include rash, agitation, and headache. This drug was appropriate because the patient has a diagnosis of major depressive disorder. With this medication, it is important to teach the patient to report to the hospital if they feel like harming themselves or committing suicide. The patient was also prescribed furosemide for hypertension. Side effects include hypotension, hypokalemia, and an increased urine output. It is important to monitor blood pressure and electrolytes closely with this medication. Cholecalciferol was prescribed to prevent bone fractures. This drug is appropriate because the patient is diagnosed with osteoporosis. Side effects include nausea and vomiting. Levothyroxine is prescribed because the patient's thyroid was removed due to cancer. Side effects of this drug include hypotension and tachycardia. Patient teaching includes taking this medication 30 to 60 minutes before breakfast every day. Venlafaxine was prescribed for major depressive disorder. Side effects include nausea, vomiting, dry mouth, and constipation. It is important to teach the patient to take this medication with food. Fluphenazine is prescribed for a psychiatric disorder. This medication is appropriate because the patient is diagnosed with anxiety, major depressive disorder, and borderline personality disorder. Side effects of this drug include dystonia. Acetaminophen was prescribed for fever and headache. This is appropriate seeing that the patient can develop a fever post-op. The max dose for acetaminophen is 4 grams a day or 2 grams a day if frequently consuming alcohol. Prednisone is prescribed to decrease inflammation. Side effects include glucose intolerance, increased risk for fractures, adrenal insufficiency, and edema. It is important to teach the patient to taper this medication off and to take it in the morning before 9 a.m. Oxycodone and oxycodone acetaminophen were prescribed to treat the patient's pain post-op. Side effects include constipation, hypotension, lethargy, and respiratory depression. Patient teaching includes taking these medications with food. The nurse should monitor respiratory status and blood pressure frequently on these medications. All of these medications make sense for the patient because they are all related to the comorbidities or they treat symptoms post-op. Other medications were prescribed to treat the patient's pain after surgery. The only side effect that I noted was the patient felt nauseous and was experiencing slight abdominal pain, which could be a result of many of the medication's side effects. Labs included a CBC. White blood cell count was within normal limits before and after surgery, which is a good sign that the patient does not have an infection. The patient's hemoglobin and hematocrit were low post-op. This could be due to blood loss during surgery. Platelets were ordered to see if the patient was a risk for increased clotting or inability to clot. The patient was within normal limits. The patient's sodium and potassium were also within normal limits. These are both taken to monitor renal function. The BUN and creatinine are also taken to monitor renal function. They were within normal limits, which means that the kidney is functioning normally. ALT and AST were taken to monitor liver function. They were both within normal limits. Glucose was tested to see if healing would be compromised due to high blood sugar. The patient's was 121 pre-op and 132 post-op. This is expected of a diabetic who does not monitor their food intake and will be monitored more closely for delayed healing. Other disciplines that are involved in this case were PT. They were involved to get the patient functioning back to full capabilities. Occupational therapy was also involved to ensure that the patient was able to function and perform ADLs well enough to return to the assisted living facility. This patient had all the needed support and help from these disciplines that they needed at this time. The patient received a left knee arthroplasty to determine the severity of the arthritis. Findings included multiple irregular and ovoid fragments. Articular surfaces eroded with areas of eburnation. This This is expected of a patient previously diagnosed with osteoarthritis. The patient also received a left knee x-ray to check prosthetic placement. Findings included swelling and thickening, joint effusion, and soft tissue gas. This is expected of a patient who had a total knee replacement 2 days ago. The patient received a 14 on the Braden scale. The patient had to use a bedpan to use the bathroom, is frequently inactive, has poor mobility, and has poor nutrition. Safety precautions that need to be considered include treating the patient at least every 2 hours, assessing the skin frequently for sores or pressure ulcers, and assuring that the patient is clean and dry. The patient is a fall risk because their gait is weak, they use an ambulatory aid, and they have a history of a secondary diagnosis. Secondary precautions include using gait belts when ambulating, using proffered transfers, the use of bed alarms, and the use of non-skid socks. The most important diagnosis for this patient is risk for infection related to invasive procedure. This diagnosis is most important because all patients post-op are at an increased risk for infection, which can later lead to sepsis if not treated. This patient has a COPD also, which causes an increased risk for pneumonia. The second most important patient problem is her pain. The nursing diagnosis for this patient is acute pain related to post-op surgical incision, as evidenced by patient received total left knee replacement. The final most important problem is immobility. The nursing diagnosis would be impaired physical mobility related to loss of integrity of bone, as evidenced by limited range of motion and reluctance to attempt movement. Interventions I implemented to help with risk of infection included ensuring I use hand sanitizer before entering and after exiting the room, encouraging proper hand hygiene for the patient. Another intervention was observing the patient's vital signs and incision line to monitor for signs of infection such as redness, heat, swelling, increased blood pressure, and heart rate. Using proper hand hygiene ensured that nothing was being brought in or out of the room. Observing the incision line, I noted that there were no signs of infection or abnormalities in this fresh incision line. The patient's vitals were all increased, which could be an indication of infection. The bedside nurse was notified and the doctors discussed further plans to monitor for this. Interventions for acute pain included administering PRN pain medications as ordered. Cold therapy was also used, and distraction can also be used as interventions. The patient's pain went from a 10 out of 10 to a 7 out of 10 with the use of PRN pain medications and cold therapy. The patient also reported that watching TV and using her cell phone kept her mind off of the surgery and off of the pain. Interventions for impaired physical mobility included ensuring that the patient is administered pain medications if possible before physical therapy and occupational therapy. It is also important to use sequentials to prevent blood clots in a patient currently immobile. The patient agreed to wear the sequentials. Other interventions included discussing with the patient goals for mobility and barriers they currently face. The patient was able to be given pain medication 20 minutes before therapy, which enabled better mobility. This intervention was successful because the patient was able to perform a better range of motion with the use of pain medications. The patient's goal was to be able to get back to the assisted living home and tend to herself and not have to move into the nursing home. Other interventions that could be effective for the patient include dietary, to teach the patient about eating as a diabetic and proper nutrition for effective healing. Pharmacy could be contacted to communicate with the patient about the extensiveness of her medical regimen and the importance of adherence. Pharmacy could also assist the patient in obtaining pre-organized pill calendars to make taking and keeping the meds more organized. Ordered interventions that would help the problem include medications to manage pain, swelling, and other comorbidities. Oxygen was administered because the patient has a history of smoking and COPD, Intensive spirometry was ordered to prevent pneumonia or atelectasis, which is especially important in patients with COPD. One referral that may be necessary is a case manager to communicate with the assisted living facility and ensure that the patient will still be able to return to the assisted side of the living facility. Routine care and assessments went well throughout the day. The only thing that did not go well was the patient's pain was difficult to control. The patient seemed calm and appreciative of the care, but continued stating that her pain was severe. It was difficult in finding balance between controlled pain and the patient's respiratory status. What went well was applying the patient's dressing. The dressing change went well because I had never applied this type of dressing and I was able to learn how. What didn't go as planned was trying to manage the patient's pain despite medication and adjunctive treatment. It couldn't be nipped. I did feel confident during the day because I have gotten better at communicating with the patients and getting better at being confident and making myself look more trustable. As a nurse, I learned how to apply an Aquavac dressing. I also learned how to better communicate my understanding to the patient and to let them know I understand their concerns and needs. I think that the patient was receiving appropriate care, however, her pain could have been better managed. It was a fine line between the patient It was a fine line because the patient was ordered IV pain medications, but her respiratory system was coming too compromised and they were discontinued. One adjustment to care I would make is to obtain another white blood cell count to see if the patient was showing signs of infection due to her elevated heart rate, blood pressure, and the temperature was edging high.